So I think why is a really important question, because why is a good antidote to this ultimate four-letter word called fear. So they don't even have to say you have cancer. They should just walk in the room and go, be afraid. Be very, very afraid. You got this really stinking bad thing that you didn't think you had yesterday, and we're gonna brutalize you and it may not work. Holy crap, and I'm scared too. Fear. So why we do something is maybe important. And my idea is that within the drama and trauma of trying to kill cancer, maybe we should listen. Maybe we should listen to that person, whether we do it with our hands or our senses or our ears or our eyes or hopefully all of that. We should listen. And what we'll hear is, I want to be happy. I want to have purpose. I want to be stable. I want to be in harmony with the balance, or balance with the harmony. They both work, I guess. All this good stuff. So what do we have to do that ourselves? Because I think that's what medicine is doing it yourself as practitioners. And then saying somehow to invite that person into that experience of true wellness. Not getting their wellness. Not if you do this, this might work, or this really will work. If you take this herb from Peru, this will cure you. Maybe. But why do you want to cure you? So you can come all the way back to where you are now, human being, sitting, breathing. We forget that all the time in cancer world. We forget that all the time. It's the perfect excuse to not be present. It's the perfect excuse to be scared. You want to be scared? Enter the perfect culture of fear. Cancer. And yet, 1 out of every 1.5 people in America gets cancer. Huh? Something's wrong here. And people like me, naturopaths practicing in cancer centers, you can count them on like 1 or 2 hands. This is not a common thing. I would like to change that. I need your help. Hopefully I've changed it a tiny, teeny bit. And so many cancer patients go to their oncologist and say, what else can I do? And the answer is generally, well, you're doing the best thing, man. You're doing the ultimate oncology. This is it. Chemo, radiation, and surgery. The rest, forget it. Not evidence-based, not proven, quackery, dangerous. Don't do that. You are doing everything. What else can I do? What can I eat? Doesn't matter. What can I eat? All right, go see the nutritionist. Go to the nutritionist. What can I eat? Doesn't matter. Just eat calories. Sugar's good. Bye. But what do I do? Well, you come back on Tuesday and get your chemo. I think we can do better. So I kind of think that I'm the answer to that question, and you guys are the answer to that question. What else can I do? Holy crap, there's a lot you can do. Like he was saying, from, stems of plants to all the stuff that you guys do as practitioners and patients. There's a lot you can do. Just remember why. Otherwise, you'll never get there. So the practice of integrative medicine for me is being there myself. It's not possible to tell somebody what to do if I'm not doing it. What good is that? That's icky. I can't do that. So I get my pedometer and I walk my 10,000 steps. And I'm a goofball and I enjoy my life and I try and be of service as much as I can and not take myself too seriously and try and learn every day because I'm a beginner. I've only been doing this 15 years. I don't know what I'm doing. And be honest with the patients. And try and bring the answers or some answers into that person's life who says, what else can I do? So let me tell you what that looks like. That's enough theory. This is what it looks like, I think. I've never done this before, ever. I hate giving the same lecture twice. I hate boring myself. So this is what I think it looks like. You wake up and you're rested. Whoa. You're rested because you slept well. You know how rare that is in the cancer experience? Because not only are you toxic from your treatment, but when you lie down on your pillow, your mind goes, oh yeah, you're mine now. Yeah. You look like bacon to that mind, you know, or asparagus or whatever it is. It's like yum yum. And you're like, oh my God, you know, there's like no distractions, and you know, you already did your yoga and you meditated, and it's like, I need to go to sleep. Yeah, but admit it, you're scared shitless. Yeah. And it eats you up. It affects your sleep. And you're constipated and exhausted and you lost your hair and, you know, all that good stuff. So you awake rested because you've been caring for yourself the day before. You wake rested. Huge deal. Then you eat maybe this beautiful protein smoothie with glutamine in there and probiotics and turmeric and cinnamon and this gorgeous herbs, and it's like healing, and you feel good, and your body's recovering from your treatments, and you're doing something that's delicious for yourself, and your partner made it for you, and they're so happy, like, oh, here, yeah, here's your smoothie, and they like bake it so nice, they put a little sprig of mint in there, you know, a little design of raspberries with your name on it, like little faces in the raspberries or something. It's just so great. It's like so nourishing. I don't have to get anywhere. I don't have to wait till the CAT scan in 6 months when the guy's going to say, well, the bad news is, or the good news is, but the bad news. The good news is you're clear, but, you know, we never know. So you just got to do 6 more months of chemo because we never know. It's like a really important insurance policy and it'll reduce your risk and all that stuff. You don't have to wait for that. You can actually be alive, which is what you want, which is why you do chemo. Otherwise, nobody would do it. You know, you got to buy the insurance policy or whatever it is. So you eat the smoothie and then you look forward to your day, even if it's a treatment day. Because you know you have tools that are going to get you through that. And maybe you go and you get Reiki there, or you breathe, or you read something, or you write, you know, you write, you know, just like get it out. You know, you do your morning pages, like, you just get it out, and then you feel this weird thing. I think she said, Amy said, you feel happy. Wow, that's weird. Being happy in a chemo room. You're not supposed to do that. I mean, you're actually supposed to. They like, you know, you're supposed to kind of act like it's cool, but, you know, it doesn't work too good. But the joy is still there. I know that. I've been in many chemo rooms, unfortunately, myself and as a doctor. And the last time I was there, I had this amazing experience. Oh, I better watch the time. I could just ramble on forever. And there was, I was visiting a patient, Oh, actually, no, I think I was a patient. And there was this elderly couple in the corner, and they were just your classic trashed picture. They were just like white as ghosts and bald and like, and they looked horrible. They're pretty much the opposite of everything the American Cancer Society shows you. You're like, hi, I have cancer and I'm doing great, and I got my new wig. None of that. Like the reality of it. They're in the corner. They're just, it's horrible. And they're just gone. There's like no life in these people. They're just, and I don't know why, weird. Somebody came in with a little baby. Maybe they came to where the receptionist lady was in the corner, maybe to make an appointment for somebody. And they came in with this baby, and these two people were in the corner, and they looked up and they're like, and like their whole body language changed. And their whole face changed, and they're like, the light came on in their eyes, and I'm watching this, and I'm like, oh my God, they're not dead yet. They're alive, they're like full of joy. And they're just like, oh, it's so cute. And the baby's like, It was amazing to see this dialogue in the middle of chemo world. The baby, the newborn, and these people are probably gonna die from their treatment and or cancer. And it was beautiful. And then the baby left with the mom, and they're like, yeah. And I was sitting there like, wait, no, don't do that again. Don't, whatever you do. We need more babies. We need babies in chemo world or something, or dogs or goldfish. Like, it's there, I just saw it. That person's in there. Real life, they're alive, there's love. Even now. I've seen people die with that. I've seen people die happy, even though their body's completely gone. You can do that. Why not? They're not related. We're taught they're related, but they're not related. You can be happy when your body's not happy. That's kind of an important skill to have. So anyway, you go in there and you're in chemo world and you're doing your thing and you bring your beautiful lunch, and then maybe you go to work, and work has meaning. And you get a little nauseous or a little cuckoo crazy from the chemo because they pre-med you with dexamethasone and Benadryl, and you're like, feel like shit, and you get a little nauseous, and you take this homeopathic Nux Vomica, and it's like, feels really good. And then you go home, and of course, your bowels are screwed up from your treatment. Like, so you call Dr. Weizer, or you're one of these, one of you guys, and you give them this super simple advice, whatever it is. Eat some prunes, or take a walk, or drink some water, or eat some flax, or, whatever it is. And they're like, oh, thank you so much. Because you're caring for them, and they're receiving that care, and it's a relationship. It's a partnership. And they get better without drugs. Not that drugs are bad or good, not that, herbs are bad or good. They're just things. But what's the most gentle thing we can do that doesn't hurt? That's a good question too. What's the most gentle thing we can do? And gentleness has extra meaning when there's war. It's a really good contrast. When there's war, that's when you most need gentleness. That's when people think gentleness doesn't matter. You just need more force. No, not true. That's actually when those little asparagus or whatever, the oregano twig things, that's when they're really important in the war. That's when the onions are really important. That's when mushrooms are really important in the war. Gentleness. Gentleness of spirit, gentleness of mind, gentleness of body. And so you do your work, you have your purpose, you don't have to wait 6 months, you go home, you're with your partner, your family. They say, I'm scared. And you say, I'm scared too. Now what do? You talk about what's important. instead of being frozen and not talking. You share. Then who knows? You might do something crazy like make love or watch, the Three Stooges. I don't know. But you enjoy that day. And then you go to sleep and there's peace. Yes, there's peace. Because cancer is your gold engraved invitation to the land of no bullshit. You want to be enlightened? Get a cancer diagnosis. It might start getting through like, mortal. Mortal. Oh, wait, is he talking to me? Yeah, I am. Back in the oncology office. It must be me. Something wrong here. Me mortal? I don't think so. Him mortal? Yeah, not me mortal. Oh yeah. Okay, well, you just did 4,700 lifetimes of Buddhist meditation. That's it. And you're mortal. You got it. So now what do you do? So it's an incredible opportunity to transform, to grow. And there's so much that we can do to help people go through this cancer experience, body, mind, and spirit. So patients come in. So I sit in St. Vincent's in the Cancer Center or Proud Portland in the Cancer Center, and most people have never seen a naturopath. I say, well, this is what we look like. We're tall, bald, and goofy, and they, have you ever seen a naturopath? No. Do you know what we do? No. Well, this is what we do. You know the lump and the bump? Yeah, that's oncology. The rest is mine. Body, mind, and spirit, that's mine. And it's yours too. That's the biggest part. I don't care if somebody's got super bad cancer, it's still a small part. The rest is still the person and their history and their story and, the whole deal. So somehow, in the miracle of medicine, I get to do that in Providence. And I think that's really important. We were talking before, a few of us, we were talking about why that might be important. Why is it important to have integrative medicine? It's important because it's simple. It's important because it's respectful. It's important because it's easy. It's important because it's holistic. I mean, the whole picture. Drugs are just a part of it. How about the whole deal? Drugs are just the last 50 years, where we figured out how to mass produce chemicals after World War II. But the rest of human history, medicine's been different. So how do we do that? Is it important we do that? In my experience, it is. Otherwise, I wouldn't do it. I'd go back to being a filmmaker. But it makes a huge difference, I think, in the lives of my patients. And if it doesn't, it makes a huge difference in my life. I enjoy it so much. Jules and we just recorded a radio show on Friday, a couple of radio shows, and I was saying that people think I have the worst job in the world. I remember when I first told my mom and dad, I got out of naturopathic school and I said I was going to specialize in cancer, and my mom went, no, don't do it. It's horrible. Don't do it. Which, of course, at that point, I knew I had to do it. There was not a single doubt in my mind. Thank you, Mom. Thank you. Yeah. But it's the greatest job in the world because there's so much we can do. And you're with the most amazing teachers on earth. My definition of medicine is people paying to heal you. If you think you're a healer, okay, I don't agree. You're a healee. You're learning from your patients. And it's ridiculous because they pay you. What a great gig. They pay you to heal you. You can't find that anywhere else. And obviously, I still need to learn. And what I found in practical terms at the hospitals is that the system wants that. The doctors want that. The nurses want that. The PTs want that. The OTs want that. The rad-oncs want that. The med-oncs want that. The nurses want that. Everybody wants it. Now, granted, I was scared witless the first day I walked in there. Like, oh, I'm just an unemployed filmmaker who faked his way through medical school, and what the hell am I doing? Okay, I had a little chutzpah to start the program, but I had chutzpah from being a filmmaker, you know. And I remember the first day I walked in the St. Vincent's, and this nurse came up to me, and she like caught my eye. I went, oh geez, I'm in big trouble. I'm in big trouble. It's my first confrontation with an allopathic practitioner. She's gonna whip me to shreds. I don't have enough evidence. And she came over and she like put her face right next to my face and my ear, and she went, what took you so long? I was like, oh, geez, thank God. And you know, everybody's been so great because people ask about this stuff all the time. They ask their doctors about nutrition and stress and yoga and herbs and supplements, and they don't know. That's not their world. And they don't even know what they don't know. You know, outside of like pills, they don't even know the great, amazing healing stuff you do, the magic of just, you know, looking at somebody or touching them or putting needles in them. I mean, if you can heal somebody sticking them with needles, you can do anything. People hate needles. It's hysterical. Come on. Homeopathy, it's hysterical. What we do is funny. And there's joy. You know, there's joy. That's still the most amazing thing. Uh-oh, do I have to shut up soon? Still the most amazing thing I ever heard, I think. This one massage therapist we used to have said, so when you're a doctor in cancer world, generally two things happen. People either love you or they hate you, you know, depending on where they are. They're like, oh, you're so great, you saved me, or like, oh, you son of a fat ass. So you kind of get a thick skin, and it's a good practice to not take what other people say seriously about you. It's very healthy. So when we first started, I was the first practitioner. We were at St. V, and we had this little office on the 3rd floor, and then this revelation happened, and we hired 2 more naturopaths. But we only had 1 room. We didn't have our big, gorgeous centers that we do now. And at that point, we didn't even have name tags on the door. You know, okay, that's Dr. Weizer's in there, or Dr. Chandler, or Dr. Reuter, and so nobody knew unless you knew the schedule. And the massage therapist said, I always know when you're in there. I said, how? She said, I hear laughter. Like, wow, I swear it had never occurred to me. And then I started like noticing, holy hell, we laugh a lot. And what I notice is that people come in, they go, Dr. Weizer, I have X cancer and X prognosis, and this is what I'm doing, which I already knew because, you know, I already looked at their chart. And I say, well, tell me your story. And they say, I just did. I said, no, tell me your story. They said, I just did. I said, no, tell me your story. They say, you don't have time. I say, yeah, I have time. I'm only 56. I got the rest of my life. Really? Yeah, I got time. Where do I start? Sperm and egg. Really? Yeah. And you know, it's amazing. It usually takes people like 3 to 5 minutes to tell their entire life story. And then 2 distinct things usually happen. They weep, and then they laugh. They weep because someone's listening to their story and cares, and they're hearing their story, probably for the first time uninterrupted. And then there's joy. It's like in the oncology room. Oh yeah, I'm getting chemo and I'm almost gone, but look, there's this good baby, and I don't know, when I see a baby, it just, something happens, and I don't know. It's beautiful. And so I think that's where you start the connection. And then what I try to do is give people suggestions of what they can do with exercise and diet, nutrition, and all that stuff, all the natural medicines, and yes, the doctors get my notes, and yes, I get the doctor's notes, and yes, we have weekly meetings, and we sit and talk about cases, and imagine that, doctors actually communicating, like doctors with different supposed religions actually communicating. Who cares of the religion? It's just what, it's about the patient. And what I've seen is it works. And our goal when we started was to become invisible. We don't even want to stick out at all. We just want to be a part of medicine. And I'm weird, I give homeopathy and herbs, and I've been known to put my hands on people and do Reiki and talk about meditation. I'm pretty damn weird. And it all works. It all comes together. It's okay. And what I've seen is that we've become invisible. Not because we're weird, but because we're of service. And hopefully we're humble. I don't know what we do. We just try and bring something to the table and hear what they have to say. Because anything less is confusing and jangly to the patients. Yeah. How do patients do integrative medicine? You know the answer to that? Badly. Really badly. You only get one shot at it. It's not like you can go through cancer and go, oh, well, I think I'll do it differently next time. Sorry. Time is of the essence. So you're panicked, so you get a referral from Aunt Sally or from New Seasons or this great healer you heard about, or you take all these pills you read about on the internet. Badly. Most do it badly. Most don't tell their oncologists what they're doing. Bad. No communication, no team, no integration. Not a great way to do it. Nobody knows what anyone else is doing. Just let's get everybody on the same page. Why? Because that's what patients deserve. Why? Because it's their life. So that's my call to action, I guess. And, oh man, there's so much more to say. But maybe I should shut up for a little while and give you a chance for questions or comments, or if you want to throw something. But if you do, throw the missionary chocolates. Because they're great. I know Melissa, they're great truffles, and I can catch them. Otherwise, there's a few things I want to talk about. But is there anything you guys want to talk about? Because I'm taking a lot of your time. Yes, sir.
So I really love that you're equating sort of your why led you to treat fear. I mean, and that fear and the sickness. I see a chicken and an egg thing there that I don't seem to understand. But we have a culture that thrives on fear. If it bleeds on the news. There's a multi-billion-dollar movie industry that makes the boogeyman come alive, and we watch it on cable for free a year later. In other words, we thrive on fear. So how do we convince ourselves and one another to give that up for the sake of healing?
So we have a culture of fear. How do we convince ourselves to give that up for the sake of healing? You don't. You can't convince yourself. You have to go through fire. This is the only thing in the world you can't fake. You can fake everything else. You can fake marriage. You can fake orgasm. You can fake you're smart. You just can't fake love, which is the cure. By the way, the cure's been invented to fear. So it's interesting to me because it's sort of a philosophical thing of, to me, and maybe I'm wrong, but this is the way I look at it. To a certain extent, allopathic medicine looks at health as the absence of disease. Disease exists, you give anti-disease pills, and then you get to this thing called health. I look at disease as the absence of health. So I try and expand health, not have less disease. I don't fight war, I fight peace. Same thing with fear. I don't fight fear. I just have to completely, every fiber of my being, be in my own fear and see what happens. Not to make it better, not to make the boo-boo go away, but the courage to stand in my own fear, whatever it is, honestly, and see what happens. And that's a lot of love. And otherwise, you'll know. You'll know. And cancer patients are good at that. They're good at reminding you of that. Hey, by the way, I need you now, really bad. Me, focus on me. Life and death, here, me.
I just wanted to say that with, I think a lot of fear is a fear of mortality, and so many people just don't like to admit that they're mortal, and you've mentioned that at the beginning of your talk. And I think a lot of what happens when you're faced with it unexpectedly is you kind of get this crash course in like figuring out what's important in life.
Right.
And I think part of healing is sort of coming to terms with the fact that you will die. You know, you're never going to be healed of never dying.
Yeah, so forgive me for paraphrasing, but just for the videos and people, she was saying that cancer is kind of a crash course in understanding and confronting your own mortality. Is that somewhat accurate? Yeah, guess what? This is not new news. You've always been mortal. It's just more obvious. Do you think your doctors aren't scared? They are. That's why they do what they do. You need to teach them. But more importantly, you need to ask why. Why are you doing this? Are you doing this out of fear? Quite frankly, most of what I see most people doing is out of fear. That one day in the future, in 5 years, when they get clear from their oncologist, in 5 years they can go, I'm okay, I'm alive. And I'm sitting there going, whoa, dude, you're alive now. You're okay now, totally. And you're gonna die. That's what I tell my students. Students, every patient of yours, they call them cases. I hate that, my case. Every case that you work on is gonna fail. And every patient's gonna die. So relax. And you're gonna die too. What's the big deal? Are we so disconnected that we don't know the circle of life? Yes? So when you try and prevent death, isn't it odd that you take death to prevent death? I call cancer homeopathic death. It's like, here it is. Here's just enough. You don't want to live? Here it is. Here it is here, here it is here, here it is here, here it is here. Come on, come on. What if we didn't have to be this is a radical. What if we weren't afraid of death? How would we practice? Probably, that's a kind of important question. More importantly, how would we live? Interesting. I don't know. I'm trying. I'm just a bozo on this bus like me. To me, you're all enlightened and I'm the only bozo. That's the way it works. But other questions or comments? Or chocolates?
How do we as patients, or do you have some tips or tricks for us? You were saying that we do it so badly, integrative care as patients. How do we do it better?
Yeah, I think that's a really great question. This radio show, the creator of this radio show wrote me this email saying that is the main thing patients want to know is how do they do integrative medicine? How do they do it well? So I'm completely, totally biased. I'm sorry. I can only give you my viewpoint. So first of all, and I'll just can I limit it to Portland, Oregon area, not the world? Okay, so Portland. So my bias is that most naturopaths are poorly trained in oncology. I say that because I taught oncology in the naturopathic college for the last 12 years, so I taught them. And one of the reasons I did a really bad job is because it's one term. Oncologists go to school for 10 years. I had 10 weeks. Fourth year, most of the students are not even awake. And now these days, they're all on their computers doing things on eBay anyway. So they have no experience, very little knowledge in an unbelievably complex field. There's new drugs coming out all the time. You gotta know a lot of shit to do oncology. So bias number one, go to the people who do this full time. You know, don't go to people that have exclamations and or bold and or italics in their marketing. Where's the marketing person? If you see that, run. Integrative medicine should be gentle, simple, and affordable. It should have little or no rah-rah factor. It shouldn't be about the charisma of the practitioner. In my opinion, it's best done integrated in with the entire medical team. I think that's very important. And go by your gut, you know, try people out. Get the name of the 5 people in Portland that do it all the time. Check them out, call them, see what you think. If you don't like them, get somebody else. And always err on the side of less. You're already doing oncology. Believe me, that's war. That's enough. Now you need to do peace. Just focus. More is not better. And in my bias, and what I tell patients is, I think this works the best structurally, is create the simplest dyad, or the simplest structure for medicine. And in my opinion, the simplest structure is oncologist that does all the oncology. You know, that refers you to the radiation oncologist, that refers you to the PT, that is the top of the funnel of all of the allopathic treatments. Get a doctor you like who listens to you and who's going to work with this other person like me or somebody else who's going to be the top of the funnel for all of the non-allopathic treatments. Keep it really simple. Otherwise, it's really easy to get fragmented. It's really easy to wind up. The most common thing that happens, people come in, hi, Dr. Weizer, I have this cancer and this prognosis, and ba-doom, this is the bag of what I'm taking. They almost always come in with this huge bag of supplements. I don't know why I'm taking them. This guy gave me this guy gave me this guy gave me this. I don't know what they do. I don't know if they help. And the oncologist is probably freaking out. And one of the main things I do is like, okay, you might want to hold out on those for a while. And the biggest sin is they're often missing things they really, really need to prevent their neuropathy or their diarrhea or constipation or cachexia or whatever. So keep it simple, get experienced practitioners, take your time. Don't be panicked, don't be afraid, because you're going to make bad choices if you're afraid. I know I keep saying that, but unfortunately that's what happens. And don't settle for anything less than really, really great care. And trust your instincts. I can't tell you how many patients are like, I'm not sure about this doctor, or this doctor doesn't listen to me, fire him. There are plenty good oncologists in Portland that work with naturopaths. If yours doesn't and you want them to, fire them, get another one. The drugs are the same. So it's all about you. That's my opinion. Are you all stunned or bored or digesting? Mark Twain said, to eat is human, to digest is divine. And that's really true in cancer. So let me just talk about, if I could, about this one practical thing that I think is really important, that I tell my students, or I did at NCNM, and none of them believe me, until they got out and started practicing. I'm like, Dr. Weizer, can you tell me about that one again? So let me explain practically why what we do is so important. And I'm sorry to keep looking at my iPhone, but it tells the time. Oh my God, 3 calls. And so let's just look at cancer treatment and then look at what integrative treatment can do. So you get a lump and a bump, okay? So you're in the shower, let's say, scrubby-dubby-dubby, and outer quadrant of the breast. So then you go in, you get it palpated, and you get the mammogram, you get the ultrasound, you get the biopsy, okay. Bad lump, okay. So what are they gonna do? Cut it out, then maybe hormonal treatment, but maybe chemo and radiation. But the main thing people get is chemo and radiation. Let's just talk about chemo for a minute, just to keep it simple. Why do they give you chemo? What the hell is it? I was just telling Jules today, it all started, well, it actually all started in World War II, when they were trying to figure out what was the best way to kill the most people, because that's what you do in war. And so from World War I, they figured out, oh, it's really cool if you like gas people, because then you don't have to see them and shoot them or waste money on bullets and guns. You just like gas them and they all die. It's really great. So they're doing experiments on how to gas people, the best gas things to kill people. And of course, they did it on mice first. And so they did this thing with mustard gas. And this one mouse had a tumor, and they gassed it, and the tumor went away. That was the start of oncology. And then a little later, in Boston, there was all these kids dying of leukemia, and it was pretty much 100% mortality, and this one totally cuckoo crazy guy in the basement of Children's Hospital was experimenting with these cells with all of the things he could find in nature. And he found Madagascar Periwinkle, which is a common household decorative plant. I have it at my house, called Vinca major, Vinca minor, and Eureka. It killed leukemia cells, and they tried it with some kids, and most died, and some survived. I was like, wow, this is amazing. It cures cancer, and so that's the start of it. So most chemotherapy is herbal medicine. Why do they give it? Because, by the way, nature makes the best poisons, by far, the best. And so they put this stuff in your body because cancer grows fast. You didn't have a lump and a bump, now you have a lump and a bump. The only reason that chemotherapy works is that the cells in your body grow at different rates, okay? Hairs, if you have them, grow fast. Ears grow slow. This is why the American Cancer Society sells wigs and not fake ears. Because when you do chemo, your hair can fall out. Why? Because it's growing fast. How do you grow fast? You eat fast. That's the way it works. The more you eat, the more you grow. It's the law of nature. Generally, you can live fairly well without hair. I mean, I've tried to most of my life. But there are kind of important parts of your body that you don't want to do without. The fastest growing part of your body is your gut. This is my preaching. I love this part. The tube from here to here. We're just worms with arms and legs that take us to new seasons. That's pretty much it. This tube from here to here, that's as graphic as I'm getting, is where the outside meets the inside. That's why you put things in this hole and hope that things come out of that hole. And then something magical happens in the whole long thing, and you're alive. But the gut turns over every 2 or 3 days. That single lining of cells. And it's lined with 100 trillion bacteria, which we kill with antibiotics and steroids and lots of other things and chemo. So you're taking that little life-giving tube. 40% of the protein that you eat every day is recycled gut cells. So I'm very sorry if you think you're vegan, you're not. And if you think you're not a cannibal, I'm sorry, you are. And if you think you're not a self-cannibal, yes, you are. 40% of the protein. So people going through chemo, that's destroyed. Their forest, their inner forest of bacteria and that lining of cells where all of the nutrition comes from and almost all your immune system is there because that's where the action is, right there. Their immune system is annihilated, their gut is annihilated, their inner forest of bacteria, which we know nothing about, is annihilated. Guess what? We know how to rebuild that. Not hard. You know how? Onions and mushrooms and herbal stems and chocolate, of course, and love and smoothies and glutamine and protein and food and exercise and hydrotherapy and Reiki and probiotics and fermented foods. People have known about this stuff forever. But here it's emergency medicine. Here it's the difference between life and death. Why do people die of cancer? Most people with cancer do not die of cancer. They die of malnutrition and infection. Totally preventable and related. We can fix those. You just got to rebuild as you're destroying. Sorry, I get a little excited about this. I'm actually usually really, really quiet. Patients come in, they're like, do you talk, Dr. Weizer? As little as possible. Yeah. Here, let me give you this. These are my suggestions. Bye. But I don't know, somehow get riled up. So that's it. We're all here. We're all mortal. We're all little drops of love. We've learned fear. We can do a lot for each other. We can learn. We can support each other in a humble way. Let's do it. Let's network and create structures in hospitals and everywhere else where people can go and live. Live when they live and live when they die. Just my opinion. So thanks for your ears and your kind faces and your open minds and open hearts. I hope this was helpful, and you can always call or email to say bad things or nice things, or if I can help you in any way. You know my contact information. Maybe I'll leave a few cards if anybody wants them. And I wish you guys all the best. If you're a patient, I wish you guys the best in your journey, and how fortunate you are to be with all these credible human beings that are of service. And if you're a servant, then I hope maybe you'll take something from this and you'll listen to that deep thing within yourself, where you find that peace, that unshakable peace within yourself that you can then bring that light into this most dark situation. So, thanks.